I want to discuss a Black female physician by the name of Dr. Susan Moore. She was an Indiana physician. She died, family, of COVID-19. Watch this. After this Black woman alleged that she experienced racism while undergoing treatment. This is our dear sister. Somebody say her name. Somebody say her name. Now, I want to weave together a couple of different thoughts this morning. And again, understanding that these incidents that continue to accumulate in quantum speed. How many of you all know we're not dealing with random stories of Black death and Black mistreatment? Let me tell you a story. We're dealing with, watch this, with multiple stories. I'm reading from the Washington Post. A Black doctor alleged racist treatment before dying of COVID-19. This is a quote, as you can see from her, it appears, this is how Black people get killed. Listen, family. It says, struggling to breathe. I saw the video. I don't know how many of you all may or may not know about this story, but I want to weave together a couple of different points. And I pray that you are well. Don't forget what I said as I'm reading these stories. We are in our finest hour, Black family. Struggling to breathe and pausing between sentences, Susan Moore mustered enough energy to record herself from her hospital bed where she was being treated for COVID-19, the illness caused by the coronavirus. The message she shared, not even her status as a doctor, shielded her from the inferior medical care long endured by African Americans. Her doctor didn't believe she was short of breath, she said, even though he knew he was treating a fellow licensed physicians. Staff at the hospital near Indianapolis attempted to discharge her early. Y'all listen to this. They attempted to discharge her early, Moore said, and her pleas for medication to quiet pain in her neck was met with sneers. I'm quoting her now. I was crushed. He made me feel like a drug addict, and he knew I was a physician. I don't take narcotics, Moore recalled in December 4th video viewed by millions. I put forward and I maintain if I was white, I wouldn't have to go through that. Moore, 52, died this week, another victim of a virus that is raging African Americans and exposing racial disparities and discrimination rampant in the nation's healthcare system. Now, I'm going to show you the finesse of the media with this. I'm going to show you the finesse of the media with this. Are y'all hearing me today? Her video, first shared in physicians' Facebook groups and more broadly after Moore's death, has become a rallying cry to confront bias in the medical system. Indiana University Health System, which operates the hospital, declined to comment on the details of Moore's treatment, but said it would implement new, quote, anti-racism, anti-bias, and civility training for all team members. Doctors who followed the case cannot directly link Moore's death to the problems she recounted in her early treatment. But Moore's story of her pain being dismissed reinforces what studies have repeatedly shown. What have studies repeatedly shown? Even taking wealth, education, and insurance status into account, Black patients receive worse medical care and face worse outcomes. African Americans are routinely means what, family? Regularly. In other words, this means this is the practice, this is the norm, this is the rule, rather than the exception. And this is the world admitting that Black folk experience medical discrimination. It says African Americans are routinely undertreated for pain compared with white people who have similar conditions. Physicians are more prone to racial bias as they become burned out, a particularly salient finding as the pandemic leaves hospitals overburdened and overworked. It goes on to talk about how even Beyonce and Serena Williams shared their stories of near fatal pregnancy complications, showing how their international stardom didn't shield them from high rates of maternal complications facing African Americans.